I want to provide you with a video that helps you best understand how to complete the opposing viewpoints paper. So if you go to, I think it's our second tab, Assignments with Grading Rubrics, and click on, you now can see discussion boards as far as the grading rubrics for both your post and your replies. And next you see the opposing viewpoints paper. So within this folder, you will know that this paper is due in Learning Unit number 5. I'm going over it right now in Learning Unit number 3 to give you the opportunity to work ahead and to start to think about this. So you're watching this video, and the first thing that I want to go over is the information that you do have in your syllabus. It's on page 10 and 11, but here it is again, and let's see if we can get a better view of this. Sure enough. So this assignment is worth 100 points, and so that's a lot of points, as you can realize now in your third week of this course. So what I'm asking you to do is to look at different viewpoints, different cultural viewpoints that may be very, very different from your own. Because working in global health means that we are often going to encounter different viewpoints. So developing the ability to appreciate without judgment can be very difficult. Viewpoints that differ from our own is critical to being able to provide culturally competent care, and most importantly, to contribute to optimal patient outcomes. But I'll tell you, there are cultural practices that we're going to look at that are physically and psychologically harmful, especially to women and children. So it takes a lot to appreciate without judgment that there are different viewpoints, and to better understand why some of these practices, these harmful practices have come about, and why do they persist. So in order to bring about change, we need to understand why they developed and why they persist. So it's not asking you to accept someone else's viewpoint, because some of these practices we absolutely can't accept as far as being because they are harmful, but to discuss it with an understanding. So that's why I call it opposing viewpoints. There's probably a better name for it than opposing viewpoints, but seeing another's view, another's perception, looking through the lens of someone else's eyes, and at least understanding why these practices continue. So I'm asking you to be respectful, consider another viewpoint that is probably in opposition to your own, and knowing that this is the way to get to optimal patient outcomes in global health, because we are treating others with respect and dignity. So you're going to find out that there are reasons why people do these practices, why they continue, and they're based on social, cultural, economic, or even political factors. So you can work with another classmate. So two people can work on this paper and submit one paper. And it's going to be not a lengthy paper, but a 2 to 3 page paper, but that doesn't include the title and reference pages. I do want you to get used to an APA formatted paper has a title page and a reference page. So, and you can see what they include in your APA The Easy Way book. You're going to go to this website, and you will select one of these practices, either female genital mutilation, son preference, SON, so that's also considered gender biased sex selection, or child marriage. You pick one that you're most interested in, And you will click on the site and you will see that it will take you to those options. You can get specific information about those practices, whichever one you choose, by reading through these instructions. You go to the site, click on what we do, scroll down to ending gender-based violence and harmful practices, and then pick one of the three. You're going to read the information about what you've selected. I also want you to read this link of 5 things you didn't know about practices that harm girls, because all of these practices do harm women and girls. So you're going to also do one other thing, select a peer-reviewed journal article from our Mercyhurst University Library's database. No, you're not going to just Google something or even ask ChatGPT for this. I want you to go to the library database and find an article that is within the past 5 years. There is a video about searching the databases. And so based on a review of the information in the journal article, you're going to write a 2 to 3 page reflection on that practice that demonstrates your understanding, not your support, but your understanding of why this practice began and continues. Here is the grading rubric. I'll let you read through, but this is how we get to 100 points. And yes, I do read through and use these grading rubrics when I grade. So that is this section of it, but also within this is a number of other information. So what is the UNFPA? I tell you right here. And then you're going to, usually I have it open in a little different way. So what is the UNFPA? Here's the website. This is in your instructions, but if you want it separately, here you go. Remember, in your instructions, there was a link to this article, but here it is separately. Here is how you search the library databases for a peer-reviewed journal article. Make sure it's 5 years or less. So, and then here is your Dropbox if and when you are ready to submit your article. So all of this is within this folder called the Opposing Viewpoints paper.